Lumen's situated right in the centre of London's Harley Street, which is a prestigious medical district in London. So the reason we're called Lumen is because our parent company is called UME, and Lumen is a term that means the brightness of light. Light represents life. Lumen is also a medical term because it refers to the inside of a structure, like the lumen of the blood vessel or the lumen of the gut. People can come in, they can spend a day with us or a few hours with us, and in that time we are using physiological tests, physical checks and scans to look inside the body and determine the state of a person's health. We've got 3 main packages and they last from 4 hours to 9 hours. And the beauty of what we do is we can go through those results face to face with the client while they're there on the day. Our clients have privacy and comfort, and they also have access to the VIP lounge as well.
Most of our Lumen clients are health individuals. What we're checking is not only their cardiac function at rest, especially during the stress. We check their cardiac function. We all know echo-use ultrasound technology has no radiation. At UME, we have usually cardiologists present to monitor the patient, supervising the exercise test. We can test any potential disease situation. We can detect minor changes in order to identify the problems in the early stage.
So at Lumen we've set up a high calibre hand-picked team, if you like, of leading specialists from cardiologists to radiologists. We are working in a multidisciplinary centre where we've got lots of leading specialists around as well. We can draw on their expertise if we find something in a client.
Why do we use ultrasound and MRI together is a very good question, because the whole idea is to cover comprehensively the entire body. So there are certain things that are better picked up by MR scan, and there's certain strong points of ultrasound. So MR, as we know, is a non-radiation imaging tool that we have to look at your brain, the abdomen and pelvis, including prostate for screening purposes, whilst ultrasound is really good to actually look for the blood flow from the heart to the brain, in other words, looking at your carotid arteries. And in addition, we look for stones in the kidneys and gallbladders that are better picked up on ultrasound rather than MR.
The keystone of most of the assessments is high resolution scanning with high precision. We get a whole new level of depth of analysis, so we can pick up things much earlier. That gives us a whole new level of accuracy.